The average waiting time in the emergency department in the state of Pennsylvania is calculated to be between 30 minutes to an hour. My name is Al-Zadjali, and I'll explain how we can reduce waiting time in the emergency department. From this video, individuals will be able to identify the different methods to reduce waiting time in the emergency department in order to achieve faster service. Individuals will also be able to differentiate between the triage system, fast track, and physician-directed queuing. Attending to patients with sudden, severe, and unexpected problems is vital. It is important to attend to patients as soon as possible. Efficient service provision to sick patients in the emergency department is important, and here's where we're going to discuss whether the implementation of a single system is better than that of a combined system, where the combined system, in this case, is triage and fast track system. The benefit of knowing this information is to help maximize productivity and patient outflow. It also helps in knowing the possible system implementation into hospitals where these systems do not exist. And finally, it helps utilize the services provided in order to reduce waiting time for individuals who know which systems are implemented into specific hospitals. A triage system is a system implemented to maximize the number of survivors by prioritizing patients according to urgency of their need for a provider. As shown by the table, individuals characterized into the red zone need immediate attention. Those in the orange zone have an expected waiting time of around 10 minutes before the paramedics absolutely must get to them. Those in the yellow zone are considered to be urgent, yet may wait up to an hour. According to Stanford's Hospital and Clinic's Emergency Department, door-to-doctor waiting time has dropped from 45 to 18 minutes with the implementation of the triage system. Individuals who are categorized into the green and blue are usually transferred into the fast track system. Fast track is a system implemented to help reduce waiting time in the emergency department. At times, fast track and triage system work as a combined system in which patients in categories 4 and 5 can surpass those in categories 1, 2, and 3. A fast track system is similar to having an urgent care system within the emergency department. Patients who go through the system usually suffer minor problems, which can be diagnosed through X-ray, history, or a physical examination. This is a bar graph that shows the change in patient satisfaction before and after a fast-track system is implemented into the emergency department. As shown, patient satisfaction on waiting time alone has increased by around 12%. The last method, which can help reduce waiting time in the emergency department, is physician-directed queuing, or PDQ. PDQ is a system implemented to help reduce the number of individuals who leave without being seen and improve the patient satisfaction by reducing the amount of time an individual spends in the emergency department. In the PDQ system, a patient enters the emergency department and finds a greeting area without waiting rooms. The patient would complete a quick initial registration and then is approached by a provider team. Provider teams consist of nurses, ED technicians, and physicians. The provider team conducts a medical evaluation and treats the patient. If the patient was in critical condition, they will most likely be sent to a room. However, patients with minor injuries are discharged in no time. Here is an article about Penn State Hershey, who redesigned their emergency department in a way to optimize resources, enhance staff ability to care for patients, and improve the quality of care. Penn State Hershey also decided to introduce physician-directed queuing into the hospital to increase efficiency for both patients and providers. Learning objectives of this presentation were to identify the ways to reduce waiting time in the emergency department and to differentiate between them. Thank you for watching this presentation.